In this slideshow, we're going to be defining indicators. First, we're going to start with what are indicators. And indicators are standards against which change, progress can be measured. And we do this against all the levels of the log frame, the impact, the outcome and the output. So we define indicators for each of those levels. But then there are different types of indicators. There are direct or quantitative indicators, which measure actual observable change. There are indirect or proxy indicators. Maternal mortality is a rare event, and because it cannot be measured easily, internationally a proxy indicator has been agreed, which is percentage of deliveries by skilled birth attendants. There are qualitative indicators, which are used to measure attitude changes, levels of participation and behaviour change over time. Now, these are often very difficult to measure, but that doesn't mean to say we don't measure them. We then have process, which is measuring something done over time, such as community participation, some forms of activities that you want to see numbers increasing. Now finally, when you're defining indicators for your log frame, we need a mix of indicators, some qualitative, some quantitative, some process, so that we have a good mix of indicators on the log frame. So what is a good indicator? A good indicator is SMART: specific, measurable, achievable, results oriented and time bound. Now this is what any good indicator should look like. In health, there are some internationally accepted indicators, such as the Millennium Development Goals and now the Sustainable Development Goals, which you would use at impact level. There's modern contraceptive prevalence rate for family planning. There's percentage of deliveries by skilled birth attendants, which is a proxy for maternal mortality. The number of women attending more than 4 antenatal care visits is a good output level indicator. Increase in retention rate of girls in secondary school is a good outcome level on an education programme. And there are 2 main ways to express indicators. One is where you define the indicator in a statement, and then you define your target and the milestones by which you will achieve that target. And that combination is a SMART indicator. Or you define a statement as one, such as a vaccination rate will increase from 65 to 75% by 2019. This is not used as commonly as it used to be, so we are suggesting that you use the first one. So for your log frame, what you do is you first define your indicator. What will you measure? Increase in percentage in vaccination rate. Then you find your baseline for the previous year or that year, depending on what's available. You then go to your target, the last column, and decide what do you expect to achieve by the end of the project, e.g. 90%. Then you decide what will you achieve each year. For example, year 1, 55%, year 2, perhaps 70%. In defining your yearly milestones, you need to bear in mind that the early years of a project take time to set things up. Therefore, the increase will not be as high as it should be in the latter years. The benefits of this method is it allows for better planning and projections, and to check your projections are actually accurate. So you look at your target and you check whether your milestones, the trajectory of your milestone, will actually achieve the target. Ask yourself, is it possible to achieve the target of an increase in immunisation by the end of the project? If not, you need to review your milestones. It also allows you to monitor progress each year. So if you have said you're going to achieve the milestone in year 1 and you haven't, you may need to look at why not. You will need to look at why not, actually, not just should. You will need to look at whether the milestone has not been achieved and why not, and take action. Whilst you're defining your indicators, you also need to be thinking of how you will verify this source. And we recommend that you use government systems, existing systems, such as the Health Management Information System, the Demographic Health Survey, rather than setting up separate surveys and baselines. reports, because that's very expensive and it's not sustainable. It's also at the same time better if you can in your log frame use a reporting year, but that does depend very much on the donors. If you do use government systems reporting year, there will be a lag time, although this is improving now with electronic systems. The ultimate benefit of using government systems and reporting time is that your funds and all your technical assistance can be used to strengthen the government systems rather than setting up parallel systems that are not sustainable. And so when your project finishes, you're leaving behind health management information system and surveys that can be used for the broader health sector.